who is head of suicide prevention for the state of Maryland. Henry, before the break, we were talking about some of the programs that are in place in Maryland, and you were talking about the Youth Crisis Hotline and how this network of services is really a model for the country. Can you talk some more about that?
The phenomenal thing is that we have crisis workers who are trained, particularly on youth issues, 24 hours a day, 7 days a week, to handle any call anywhere in the state of Maryland. You call that one number, and you can get a hotline worker instantly.
Okay.
Yeah. So, and they're there to help young people through a suicide crisis or any other crises they're having in their lives. We've gotten all kinds of calls from all kinds of issues that these hotline workers are trained to help young people with.
Well, let me ask you this question. What is it that a counselor can do by phone with someone who is feeling desperate and is thinking about taking their life? How can a telephone call make a difference?
Oftentimes when people call, I mean, when someone's calling a line, to us it means that they want to, they may have feelings of wanting to die with feelings of wanting to live at the same time. And if you can kind of listen to them, and a lot of times what hotline workers really do is a lot of listening, and really encourage them to do something positive and give them the resources they need. In fact, if they're imminently suicidal, the hotline worker will send immediate help. But if they're not really imminently suicidal and agree to see someone immediately, that will get them out of that crisis. And we find that a lot of times people are in immediate suicide crises from 24 to 72 hours. And if you can get them within that crisis period, you can oftentimes save them.
Well, one of the things that also strikes me is that one of the things that I've often heard for people who've been depressed and in a suicidal crisis has been that they really felt that there was a lack of supports, that there was a lack of anyone in their life who really cared about them. They felt like an outsider, felt alone, and it would seem to me that simply having a voice, a compassionate voice to listen, could make a difference. When we talked earlier about some of the high-risk groups, there were some groups that we didn't touch on, and it may be helpful to do that now. Are there other groups that we didn't touch on who also might be at high risk for?
Right, particularly gay and lesbian youth. We find the research is showing that high rates of attempts, particularly among gay and lesbian youth. And one of the issues they're facing is the coming out process in terms of discovering who they are as gay and lesbian people, and the prejudice they face within their families as well as the community, the prejudice they feel in terms of churches. They feel that they can't connect to other people because they're dealing with their own sexuality issues. First, they're coming out to themselves, and they do everything they can not to be gay, and the feelings don't go away. I mean, it's almost like if they pray hard enough, and read the Bible enough, maybe I will be, quote, cured, and they will no longer be gay or lesbian. And that doesn't work. Their sexuality is determined at a very young age, and so you're not going to change their sexuality. So the reality hits them, and they can become very depressed. And particularly when the family finds out that they're gay, and the family gets angry, and their first reaction may be an anger, because they don't want their son or daughter to be gay. They may kick the child out of the house, and oftentimes this is when we'll begin to see a suicide attempt during that time.
So again, it's this kind of issue of not having support during a critical time in their life, and where there's a real need for someone to understand and to be with them during a very kind of difficult discovery period. Can you talk about some of the other things that the state is doing in terms of projects to help combat suicide?
One of the things we've done for about 15 years is we have an annual conference during October. The governor proclaims Suicide Prevention Month in October, and we have a conference. It's the oldest state conference and the largest state conference in the country, we're glad to say, and it's phenomenal. This year we're going to be having it on October the 9th, and so everybody is invited. I'll give my number in case you, is it okay?
Sure.
They can call 410 402-8494.
Okay.
That's 410-402-8494. And you could have your name, place, and address placed on our list, so when our conference comes up, we can send you information about it. But it's a phenomenal conference, and we get a really a lot of support from people in the state of Maryland who attend that conference. We have like 400 to 500 people every year.
And you also have gotten, because of course I've been there a number of times, you've gotten some really nationally known folks in the field as keynote presenters, and there's a lot of new information that's shared about new and innovative approaches in terms of helping folks who are in a suicidal crisis. Now, so that's that side, that's the prevention side. But one of the other things that we recognize unfortunately happens is the reality is that at times there are completed suicides where people take their lives. Can you talk a little bit about how a completed suicide might affect a family or a community and some of the kinds of things that we are trying to do about that?
You know, that's postvention is what we call postvention, is after suicide. It's so important in that one of the things you want to prevent, let's say if it's a child who's in school and who commits suicide, and what we want to stop are other kids around that kid doing the same thing. Oftentimes they may model the behavior in terms of how you solve a problem. If a parent completes suicide, and the message it gives to his children is that this is the way you solve a problem, and suicide is not a way to solve a problem. So you want to let young people know that there are other alternatives in terms of there's help available, there's other ways of solving a problem, as well as you don't want to glamorize the situation when a young person commits suicide. And we want young people to know that that person chose the wrong, it wasn't a solution to the problem, and chose the wrong path, and that we want to show them other options as well as put the supports that they need there, so we don't have a cluster situation.
One of the things that I remember was when, of course, the rock star Kurt Cobain took his own life some years ago. I was very impressed by what his wife Courtney Love did in terms of coming out and speaking out nationally to say that this was not the way. And to encourage folks who felt bad and who felt like taking their own lives to seek help. And I think that that really made a difference in terms of a lack of clusters and emulating that behavior, because we know that especially when somebody significant, a famous person, somebody that you look up to chooses that means that there is a chance that a young person might emulate that behavior. So this postvention activity, I think, is really important. What are some of the kinds of things that you do in a postvention?
Well, in a postvention, we may go into, let's say, the schools, and we may help them. The CDC, the Federal Centers for Disease Control, has set up guidelines in terms of how you handle a situation after a suicide. And so we will work with the school in terms of handling that suicide, in terms of giving good information and what they're not to do, like doing a memorial service in the school. You don't want to glamorize it in terms of making that child a star, because other kids will say, well, wow, Johnny is getting so much attention and nobody gives me attention. I want to go out in the glory like Johnny. Everybody seems to love Johnny and nobody loves me, and maybe I should kill myself as well. So you don't want to glamorize it. So we will work with the schools to come up with a plan and have counselors available. We will oftentimes have students talk with counselors about dividing the classes up. We don't want to talk to kids all in one big group. And so you can see the reactions of the kids and know the ones that really need help.
Okay, so the issue then really in a postvention is to identify those folks who are at risk.
At risk,
and
exactly.
need extra support.
And put in extra supports, yes.
That's extremely
right.
important. Okay. One of the things that you haven't touched on are some of the warning signs that I think parents and teachers and others need to be aware of in terms of folks who might be at risk. Can you just kind of walk through that list for our audience?
Yeah, I'm glad you brought that up, because sometimes I don't remember how important they are, because I was doing another show, and a mother called me up a couple of days later, and she said, "Thank you for giving me those warning signs." She said her daughter had almost every one of them, and what she did, she was home early and happened to cut the television on and saw the show, and then she went to our daughter's room. She said, "I never read my daughter's diary, but I opened my daughter's diary because I was afraid." And what she found is her daughter had put in, the attempt didn't work again, the pills didn't work again. And so they were able to get immediate help for her, and her husband were able to get immediate help for the daughter. They knew the daughter had been sick with a stomach ache, but they thought it was just a stomach ache, and they knew that the daughter they had moved to a new neighborhood, and they say, well, you know, she's going to be depressed for a little while, but they didn't know the seriousness of it. So giving away prized possessions, if you see someone with a prized CD collection or a prized coat, and all of a sudden they don't need it anymore, you know, so you wonder why. Someone who's having a problem or is depressed and there's a miraculous recovery, you know, all of a sudden everything is fine. Someone who says they want to kill themselves, you know, or if you see suicidal themes in writing or in drawings of kids, it doesn't necessarily mean that they're going to kill themselves, but you really should ask them, you know, are you thinking about suicide? Well, what does this mean? Use of alcohol and drugs. It's a way of, you know, if I take a little more and more of the drug, you know, maybe it will kill me. It's flirting with death. You know, racing, you know, putting yourself in dangerous situations, you know, parasuicidal, what we call parasuicidal behaviors. There are someone who it looks, the physical appearance begin to change. I mean, let's say if they were very aware of their appearance and very neat, and all of a sudden they look disheveled all the time. Someone who's depressed, of course, who has a affect that's, you know, a mood that's really low, and where they're usually up. You see changes in personality. These are some of the things that we should look for.
Well, that's good advice, and it's important for us to thank you for all the good work that you're doing. And before we end, can you give that number one more time? I'm
glad you mentioned it. It gives me a reprieve to say it right.
All right.
Okay, it's 1-800-422-0009.
Thank you. And that's a number that you can call 24 hours a day. And here in Baltimore, please remember that if you or someone you know needs help with a mental health crisis, you can call Baltimore Crisis Response Incorporated. And remember, your mental health matters to us. Thank you.